Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Hello, my name is Dr. Sam Downing. I'm a family physician by training, and over the last 6 years have been a part of Yavapai Regional Medical Group, now Dignity Yavapai Regional Medical Group, and I'm currently the director of the Palliative Medicine and Geriatrics Department. And I'm privileged today to get a chance to speak with you about a couple of programs that are developing through Dignity YRMG. And I'll tell you about those programs throughout the program today with a level of excitement in terms of what our community is in need of and a program set that we think is going to be very helpful to the community. And it's focused around the whole area of brain function, quite honestly. How does our brain age? How does our brain function as we get older? And most importantly, how can we keep our brain as strong and viable as possible? So I've titled this presentation, Cognitive Vitality. And I really like the word vitality. In fact, I looked the word vitality up prior to giving this presentation and found 4 important definitions that I'll share with you. One that doesn't entirely fit is peculiarity distinguishing the living from the non-living. So it's relevant. Vitality implies that we're living, but it also implies mental and physical vigor. And the word vigor means an activity, an active strength or an energy level, which many of us want to have as we get older, particularly in the area of brain function. But the definition that I like the most for vitality is enduring quality. Enduring quality. And remember that through this talk, and we'll come back around to that at the end. Because when we think about our brain function as we get older and really think about what we all would want for our brain to have as we get older is enduring quality. There's also a 4th definition, animation and liveliness, which is an opportunity to experience life with a certain gusto, a certain enjoyment that really identifies what is quality of life and what is pleasure as we get older. And having good brain function is an important part of that. So we'll talk about a variety of things related to brain function. So many of you who've been in Prescott for a long time, and I've lived here about 32 years, you've seen the area grow. You've seen the area change in many ways, many of them positive. But one thing that hasn't changed is this is an incredibly popular retirement area. Right? It's made many lists in magazines and journals and papers identifying it as probably one of the best places to retire for some important reasons. Certainly our environment and our climate, all of those things, the quality of life that we enjoy here, the general health, the health services that are available to us in our community have always been top-notch. So we know those demographics identify a geriatric or a senior-based population, people over the age of 65, and we have a large proportion. And those numbers are continuing to grow at a higher level than almost any place else in the country in terms of the proportion of people who are senior-aged over the age of 65 and living in our community. We know that cognitive problems are I'll say brain failure. I oftentimes use the term brain failure. If we think about our body in terms of our organ systems, we know that people can suffer from heart failure where the heart pump just isn't pumping as effectively as it should be and it starts to back up. That's heart failure. We know that liver failure is something that people deal with in some circumstances. Kidney failure. You can also have brain failure, which is the brain's decline over time, possibly related to aging, but also possibly related to disease processes that affect the brain in a way that prohibit it from functioning in its normal way. We know, and I know from having the opportunity to do home visits for patients in the community, that a lot of people have experienced some level of cognitive change or memory loss, memory impairment, and we'll talk a little bit more about the details of that in a few minutes. But we also know that when we talk to almost anybody in the community, most of us know somebody who's suffered from dementia, Alzheimer's disease, or other cognitive impairment. You might not necessarily know somebody who's had liver failure or who's had a kidney transplant, but almost all of us know somebody who has been dealing with memory loss and the impact that it has on patients and families and loved ones and caregivers. Most of us, when we ask people what their wishes are as they age to improve their quality of life, most of them identify in a list of 3 to 5 important things that they want good cognitive function. They want the ability to be able to think, to be able to act independently, to keep their independence for as long as possible, to not be a burden to other people. Those are important factors that people consistently identify when you ask them what makes quality of life as we get older. So the desire for a lifelong cognitive vitality or brain vitality, again, enduring quality, is something that we all probably have on a pretty high priority list in terms of what we'd like to see as we age. So what we're working on at Yavapai Regional Medical Group and Medical Center, with Dignity as our overlying umbrella now and associated partners, we're working on a comprehensive cognitive assessment clinic. Now, I'll go into much more detail about what that means, but the key word there is comprehensive, because what we're really looking at is an opportunity for people to have evaluations done for their brain function and see how their brain is working to identify if there may be any problems coming up. Now, there may be some barriers for people to not want to get cognitive assessment, and we'll talk about those in a few minutes as well, but you can imagine that that can be a little bit threatening for people. It's one thing to go in when you got a sore shoulder or a sore knee. It's another thing to go in and have a serious talk with your doctor or your provider, about your medical provider, about what's going on with my memory, doc, or why am I having difficulty managing my checkbook? Or why are my family telling me that I need to get in to get checked because they think that my brain is slipping, my brain function's slipping a little bit. Those are the things that are a little bit more threatening than some other physical ailments that people might be more comfortable going to see a medical provider about. So what I hope to do is really break down some of those barriers so that if you or a loved one or somebody that you know and care about is having difficulties with their brain function, that they get a chance to get fully assessed and determine whether there's a problem there or not and what the implications of that problem might be. We also know that people who have cognitive or brain function challenges are oftentimes in a situation where they become more dependent on a caregiver. And so there are caregivers throughout our entire community, and this is oftentimes a silent group of people that we don't hear a lot from or hear a lot about. But the caregivers have an immense burden on their shoulders helping to take care of somebody with cognitive impairment. And so it's really, really important that whatever type of program that we have and develop in our program also focuses on the caregiver, because caregivers are the key linchpin to helping people be successful, to stay at home, and to have a higher quality of life, even when they have developing cognitive impairment. So let's take a few minutes and talk about the normal aging brain, because all of our bodies get older with time and all of our organ systems change and decline in some fashion, and the brain is no exception. Now, I like to kind of go into some anatomical detail here to help us understand what an important structure our brain is. Now, again, that's probably not earth-shattering to anybody listening, that how important our brain function is. But when you think about the structure of our brain, where it's located in our body, and how it gets supplies, all the supplies that it needs for nutrients and energy, it becomes very important to help us understand how do we protect those things? What makes a difference? Now, the fascinating thing about the human brain, and I'm not an expert in human neuroanatomy, but I will tell you this, the brain has millions and millions of cells, which are called neurons, which are basically brain cells. And those brain cells have the amazing ability of what we call duplicity, which is those brain cells can function in more than one way. And different parts of the brain can function to take over for other parts of the brain if that part isn't working quite as well. So specifically, if somebody were to have a stroke and injure a certain part of their brain, let's say on the left side of their brain, there are other components of the brain that are not injured. Those cells can pick up the duties of the part that was injured so that the body and the brain and the functioning individual can continue to go on, hopefully in a happy and healthy way. So that's called duplicity. Plasticity is very similar in the sense that our brain has the ability to recuperate and recover, and sometimes generate new pathways that we didn't even have when we were younger in order to continue to function at the highest level possible. And throughout this talk, you'll hear me refer to functioning as being the most important thing regarding brain function that we look at. The ability to function as human beings. And we'll talk about those domains in a couple of minutes, what that looks like and what that means specifically. The brain was created with some natural protection factors. Obviously, it's encased in a hard shell, which protects it from environmental insults, hopefully, but there are insults that can get through that brain, can crack the skull, can injure the brain in ways that we wouldn't want. And so that's something to be aware of. Now, there are 4 major, I call them highways or pipelines, if you will, that bring energy and nutrients to the brain. And those 4 basically highways are our major arterial supply, arteries that go to the brain. So there's 2 up in front, which are the large pulsations you can feel in your neck called the carotid arteries. You got 1 on each side, right and left. 2 large arteries in the back called the vertebral arteries that also provide energy and nutrients to the brain. Those arteries all connect in the middle of the brain that we call the circle of Willis, which is an enlarged circle of blood vessels that continue to support our brain nutrition that comes to our brain via these arteries. And if there's interruption in that blood supply, say for instance in one artery, we know that the other 3 arteries will pick up the slack and try to compensate for anything that's going on with the damaged artery or the artery that's in trouble. So we have an anatomical system that protects our brain extremely well. The aging process is a process that threatens the most important things that go to our brain, and that's really, quite frankly, oxygen and glucose. So that there's any 2 things that we want to be sure that our brain is continuing to get throughout our lifespans, it's oxygen and glucose. And those are supplied through those 4 major arteries. But there are many conditions that threaten glucose and oxygen being supplied to the brain adequately. We could spend an afternoon or maybe even a couple of days talking about the sophistication of our nervous system and the brain as the main engine of the nervous system. We want to think a little bit about what happens when our brain starts to age normally and what happens when it starts to malfunction in some ways. And I think of this, if you will, as something that I see all too frequently in my car, which is the check engine light coming on. And there are signs that we might get that tell us, let's check the engine. Let's see what's going on. We've detected a problem. Maybe we should look into that a little bit. And that may be the trigger if we pay attention to those check engine lights that come up related to either parts of our body, but in this case, certainly our brain function, that we would want to be aware of that would lead us to want to pursue getting some sort of comprehensive assessment. So we recognize that there are probably 10 major warning signs, and I'll share with you specifically from the Alzheimer's Association, which is one of the resources that I utilize on a regular basis with patients who are dealing with any type of brain issues or cognitive impairment. Talk about the 10 early signs that may be those check engine light types of things coming on about our brain. I'll go through them quickly with you. You can get more detail if you go online to the Alzheimer's Association. It's all right there and presented very easy to understand and very helpful for people to understand the differences between what's a normal aging brain or what's normal memory changes as we age versus what might be considered abnormal in terms of a developing problem that we would want to be aware of as early as possible. So I'll give you the 10 examples of early signs and symptoms of dementia, and we'll talk more about dementia as well. First is memory loss that disrupts daily life. And we'll talk a lot again about a person's ability to function normally, and when that starts to get interrupted, we know that there's a problem developing. Now that could be as simple as a problem in the knee, where my daily ability to, say, climb up the stairs from my first floor to second floor of my house starts to get interrupted. That is a functional impairment that starts to limit my quality of life and my ability to do the things that I like to do. So if memory loss starts to disrupt daily life, that's a significant warning sign. Challenges in planning or solving problems, particularly people who are typically used to planning or solving problems a lot. If they begin to struggle in those areas, that's a significant sign. Difficulty completing familiar tasks, things that we do on a regular basis without thinking, suddenly become challenging. An example for many of us perhaps would be to how to manage a cell phone, how to manage a smartphone that oftentimes is smarter than we are. Those things can be normal in terms of our ability to handle those things, or they can be abnormal if it's really becoming more of a consistent problem, especially if we were doing it fine a month ago and now we're having trouble with it now. Confusion with time or place or orientation. People forgetting days is not as important as months or what year it is or what significant events are coming up or just happened, things like that. If there's confusion around that, that's a warning sign. Trouble understanding visual images, things that they see, or spatial relationships, understanding balance and differences in depth perception, which, as you can imagine, if there's impairment in that area of the brain, you could see somebody running the risk of falling or having an injury, and that becomes very important, certainly as we get older. New problems with words, either in speaking or writing, particularly if somebody's particularly fluent in their ability to speak or have difficulty finding words that they need, or using words in an appropriate way, or putting words appropriately in sentences, or the ability to write, especially if they're used to writing and have done a lot of writing and now they're having more difficulties with writing. That can be an early warning sign as well. Misplacing things and losing the ability to retrace steps. Now that kind of threatens us all to think, oh my gosh, I left my keys and I forgot where my sunglasses were. Those are normal aging phenomena, because what we're able to do generally is go back and say, well, where was I in the last 12 hours, 24 hours, and let's retrace my steps. If I'm not able to do that, if I'm not able to remember what I was doing where I might have left my keys or my sunglasses or something like that, then that may be an early warning sign that a problem is developing. Decreased or poor judgment. People start acting different than usual or showing poor judgment, and this is unfortunately common as in our senior population as it relates to being vulnerable to scams. Somebody might be more vulnerable to scams because their judgment is impaired, and so they get a phone call asking for important personal information, and they're willing to give that out without thinking about it because of poor judgment or the ability to censor those things. So a decreased or poor judgment is a warning sign. Withdrawal from work or social activities oftentimes can be a warning sign because people are less comfortable in social environments because they know that they're not functioning as well. They know that they're having difficulties. And again, it comes back around to functioning, particularly in the area of jobs or social relationships. And finally, number 10 is changes in mood and personality. We'll talk a little bit about mental health because mental health can be confusing as far as our brain function and whether or not a person is exhibiting signs or symptoms of cognitive impairment. But mental health becomes very important. But as our brain changes, if we're suddenly noticing in a loved one a change in mood or personality, that could be a warning sign, especially if there's nothing else to explain that. So those are the 10 basic check engine lights, if you will, that is put out by the Alzheimer's Association. And I encourage you to look at those because along with that list comes a list of things that probably are more related to normal aging and something that you wouldn't necessarily need to worry about specifically. Now, I want to talk for just a minute about something called mild cognitive impairment. It may be something that you're familiar with or have heard about. Mild cognitive impairment is oftentimes a diagnosis that is given to individuals who are in the early phases of noticing some memory loss or other cognitive changes. Mild cognitive impairment really implies that a person is not having changes in their functional ability. It's not impairing their ability to drive. It's not impairing their ability to manage the checkbook or do their day-to-day activities at home or at work for that matter. And so it's felt that about 50% of people who have a diagnosis of mild cognitive impairment would go on to have a progressive condition, perhaps like Alzheimer's or other types of dementias. But 50% of them don't. And so it's not a diagnosis that automatically means you're going to have memory loss that's getting worse and worse and worse in a pathologic sort of fashion. But mild cognitive impairment is a term that's used often and sometimes given to people in early stages that may imply that further evaluation would be very helpful for them. When we talk about dementia specifically, we have to talk about domains of how our brain works, or cognitive function. And domains are those areas of the brain that we particularly depend on for healthy and adequate brain function. So I've listed them there on the slide. You can see those. They're basically 7 main domains. And dementia is really, by definition, a deficiency in any one or more of those domains. So we think of dementia as, oh, it's memory loss. It's not just memory, or it's not only memory, and people can have dementia and have very little signs or symptoms of memory loss. So the domains are memory and learning, how we get new information in and retain information, language, how we both speak and write that, and also how we interpret language from other people. Attention, are we able to stay focused in a particular area for a length of time? Executive functions are those abilities to do more complex things, multitasking, perhaps doing checkbooks and managing those kinds of things, calculations in our brain. Perceptual motor skills are basically our understanding of how our body is in the space around us, in our environment. Can we walk safely? Can we stretch and move without getting uncomfortable or lose our balance? And then social cognition is another domain that's very important, and that's how we relate with other people, how we come in contact with other people, how we engage in other people, and how we stay engaged with other people. And it's clear, as we'll talk about in a few minutes, how important that ability for social connectedness and social cognition. So any level of dysfunction in any of those 7 domains could be a sign of early dementia coming on. So the exciting program that Yavapai Regional is putting together is basically a comprehensive senior or geriatric assessment clinic looking specifically at cognitive function or brain function. To my knowledge, there's not any single entity in this area of Arizona and most of northern Arizona that has a comprehensive approach to doing assessments for folks who may be concerned about their memory or who may have other aspects of domains of brain function that they're concerned about. Now, this may be something that your family notices before you might notice it. And so referrals can come from a variety of different places depending on who's noticing the problems. And this sort of assessment could be done as a baseline, very much like you would go in for an annual wellness checkup or an annual physical to kind of get an idea where you are right now with your current ability as far as brain function. This sort of assessment can give you a very helpful idea of kind of where things are. So these are the components of a comprehensive geriatric assessment. A baseline neurocognitive test. Now these are usually performed by specialists called neuropsychologists, and we will have a neuropsychologist as part of our program who will do a limited battery of tests, but some important tests to help us identify whether or not this is normal aging of your brain, or is there something else going on that may signify a developing problem. We know that other tests can be helpful to rule out other causes of cognitive or brain dysfunction. Specifically, that might be some blood tests or lab tests. It might be a brain scan to be sure that you haven't had a stroke or some other impact going on in the brain that would be causing some sort of cognitive impairment. Blood tests looking for things like thyroid abnormalities or B12 and other vitamin deficiencies, which can mimic certain types of dementia and cognitive impairment. Those tests can be done and should be done as well in terms of a comprehensive assessment. This is a really important one. What I've found in working with patients over the age of 65 is that what typically happens in our community is, and it's not just in our community, it's literally across the country and across the world, medication lists start to grow as we develop chronic conditions, and physicians sometimes focused on one part of your body, specialists, for instance, in cardiologists or lung specialists, might be focusing on one part of the body and will put you on a medication. And then that medication is added to a list of medication that you're already on. And that list continues to grow and grow and grow. And there really, in many cases, isn't somebody who's looking at that list to say, well, maybe it's time to get rid of some medicines, or what we call de-prescribe, where we actually take away a medication and lower that list or drop that list down. Because one of the biggest challenges with medications is, although they are there for an important reason in most circumstances, to do something helpful for your body or help other parts of your body function at a higher level, they can also be very detrimental to you as well, especially if you have side effects from those medicines, or if those medicines are interacting with other medicines that you're on because you've got so many medicines in the pool. I see many patients in their homes who have medications that are almost overwhelming to them, to try to keep them straight, to remember how to take them, to remember what they're for. And so part of a thorough geriatric assessment includes a medication assessment, where a pharmacist would actually sit down and go through each and every medication, including over-the-counter medications, to say, it's probably not a good idea for you to be taking this supplement with these other medicines that you're on. So there's opportunities for us to look at a medication list and actually improve somebody's cognitive ability, because it may be the medications that are actually causing problems. So that medication assessment is a critical, major component of a geriatric assessment. And then a social assessment, or in this case, a social worker who will be sitting down with each individual and their families or loved ones and identifying what impact is going on in your life now related to your cognitive abilities, related to your brain function, that's impairing your ability to do things the way you like to do them. And that may be driving. That may be continuing to work for many people. That may be able to manage the finances at home or take care of your affairs in the home setting. Some of those things may be diminishing. What impact is that having? Who's stepping up to fill those roles if you're no longer able to do that? So those are the four major components of a comprehensive geriatric assessment, but there's some other components that are important as well. A functional assessment, as I mentioned, is specifically related to a person's physical ability to function, because we know that as someone oftentimes has impairments in functional ability, or as they're getting older and becoming less able to do as much physically, they become at higher risk for inactivity, becoming more frail or weak, and then potentially falling, which can dramatically change the quality of life of somebody whose functional situation is declining. A nutritional assessment is very, very important, and we're finding in the community, not only ours, but every place, is that there are many, many seniors who are, quite frankly, nutritionally deficient. They're either not getting enough of good nutrition in their diet to keep their body well balanced and optimally functioning, or they may not be able to afford good nutrition to enable their bodies and brains to function as high as possible. So that nutritional assessment is important. Sensory evaluation is also an important area where we will be assessing, particularly in the area of vision, hearing, and olfaction, which many of you know means the sense of smell. What we have found is that there is a clear association with cognitive impairment or brain dysfunction and dementias with sensory impairment. So if someone has hearing loss, they're at increased risk of developing dementia. If someone has vision impairment with macular degeneration, glaucoma, cataracts, those things also increase the risk of dementias developing as we get older. And interestingly, there's a close association with our ability to smell effectively and our brain function as we get older. And so we know that one of the early signs that people may show of dementia developing is their sense of smell is declining. So there'll be tests available for those three main senses to help identify whether there could be a problem developing there. And a mental health assessment is a very, very important thing. And probably the main reason why that's a critical component of a comprehensive assessment is because we know that depression as a mental health condition that people experience is also associated with cognitive impairment and dementia. So if we can evaluate somebody and be sure that they're not experiencing depression, that it is making it look like they have a cognitive problem or dementia, we can treat that depression, and many times their cognitive situation will improve significantly simply by identifying that mental health condition and treating it appropriately. So a mental health assessment is also a key component of that. Now, you can imagine that list of assessment pieces is extensive. That's not something that you go into your doctor and have done in a 15 to 20 minute office evaluation, which is what most of us experience sometimes in the real world of medicine. So this assessment is a full half-day assessment that includes all those components that we talked about earlier. Now, What are the advantages of considering getting a comprehensive cognitive assessment? Well, there are probably many, and I've listed some on the slide. This is not an exhaustive list by any means. So let's start with early diagnosis. What's the true benefit of getting an early diagnosis? Well, in this day and age, treatment for certain types of dementia, specifically Alzheimer's disease, is available. There is treatment available. But I will be honest with you and tell you that it's not curative. It doesn't get rid of dementia. It merely tries to hold the cognitive loss at a certain level and threshold so that it's not rapidly progressing. So our treatment isn't that good. So what's the value of early diagnosis? Well, the value of early diagnosis of a potentially progressive cognitive condition is you now have an opportunity to rule out all the other causes of things that might be problematic and optimize your brain function as much as possible along the way. Again, it's like addressing that early warning sign and saying, oh my gosh, we're starting to see some trouble in the engine. We've got to start addressing things in a little bit different ways. And we'll talk about what that looks like. So we can identify and treat those reversible causes like thyroid disease or B12 deficiencies or things like that. We can oftentimes offer treatment that's available today, but also, and many of you may be reading about this too, there are treatments that are right on the threshold of being approved that are also looked at very favorably to slow down the progression of dementia and in some cases maybe help prevent the disease. We also know that this type of comprehensive assessment is a baseline test. So if you needed to have a test in 3 to 5 years because now you're starting to show some decline and difficulty at work or difficulty with driving, you can go back in that original test and say, well, this is how my brain was functioning at this particular point in time. And now I can compare that to additional testing and say, what change has occurred that might suggest a progressive condition? It certainly will help plan and prepare for the future. Many people just want reassurance that their brain function for their age is normal. And that can be very helpful. It helps us relax and understand that there are some normal changes that do occur with aging, but that we don't really have to worry about a lot of those things in terms of them being a sign or a problem that something more serious is developing. But if there is identification of a problem that is likely to progress, then maybe I can start to work with my family and loved ones to better plan for my future and what my needs are going to be if I'm the one suffering from a developing and a progressive condition. There may be more and more benefits to genetic counseling, where if I have a condition that's starting to show up, I can then have additional assessments done for myself, but then also share with my loved ones, my genetic offspring, the potential for them to be at risk for those conditions as well. And then finally, it's really an opportunity to start supporting the caregiver right in the early stages of a disease process that may be putting more and more strain on the caregiver. So we cannot neglect the importance of caregiver and caring for the caregiver as we identify folks with cognitive challenges and cognitive impairment. So those are some of the many reasons that one might want to consider getting a cognitive assessment. So what are the risks of having a cognitive assessment done? Well, and if I was really a guru here, what I would do is make that little scale, that little teeter-totter tip toward benefits, because clearly the benefits of a cognitive assessment are much better and far outweigh the risks of a cognitive assessment. I wrote down a couple of things that might be potential risks, why somebody might not want to get a cognitive assessment. But the truth is, we really haven't studied that very much because we really don't think there's much risk in having a comprehensive assessment done. But one may be that if, in fact, somebody does have a progressive condition developing, that they in some way get labeled as a patient with dementia or a patient with Alzheimer's disease. And that labeling process can sometimes cause stress or depression and anxiety, both for the individual with the condition, but certainly perhaps for family members and loved ones. We know that if somebody is identified with a cognitive condition that's progressing and they're started on medication, there's some potential treatment side effects that we would want to be aware of. So that would be a potential risk. And I guess some possibility of increased isolation where somebody having that diagnosis would feel now suddenly less comfortable in being socially connected or out and about in their normal fashion. But really one of the most important benefits is the ability to tap into critical support services. And these services are really growing in our community. And it's important to know once an assessment is done, And if I am given a diagnosis of a progressive cognitive disease of some sort, what do I do now? What does my loved ones do now? How do we prepare for the future? And what support services are available? And certainly that can include the Alzheimer's Association, which is one of the most important countrywide and international support services for these sorts of persons who are dealing with these conditions. We know that peer counseling is available that can be supportive both for the individual with cognitive impairment and their loved one. We know that respite services or giving caregivers a break is important. And I'll take just a minute to talk with you a little bit about what's listed there as the ADC program. And that's a new program. That's the second component along with the comprehensive assessment clinic that's developing at YRMC. We're also developing an Alzheimer's and dementia care program. And this is specifically a high-level or high-intensity care management program for couples living in the community, one of whom has been diagnosed with a dementia of some sort. And there's a whole bunch of different dementias that we won't go into. But the whole idea is to support people in their homes who are living with dementia and support their caregivers. That program is managed by a nurse practitioner. That nurse practitioner is already up and running, and we are taking referrals for that program now. We'll give you more information on how to access that program, but it's specifically designed with three main purposes. The first is to improve quality of life for individuals and their caregivers living with dementia in the community. The second is to try to help people stay at home after a diagnosis of dementia or cognitive impairment, because we know that once somebody goes to a facility or needs to be placed in some sort of a memory care unit or something like that, suddenly the cost of care really starts to escalate dramatically, and sometimes it's out of proportion to what people can afford. And then the third impact that we hope to have is really keeping costs of medical care down, not only for individuals, but also for society as a whole, because we know that sometimes with complicated conditions like memory impairment and cognitive impairment, that individuals go to the emergency room for things that could be managed by phone, or they end up in the hospital when maybe they didn't really want to be in the hospital. And so this program will be focused on trying to help keep people in their homes, keep them safe and sound, and have a support structure built around them for both the individual living with dementia and their caregivers as well. So tapping into those important services is what really early identification can be all about. So I want to spend the last part of the talk talking about what's probably most important to all of us is what can we do to keep our brain strong? What can we do to really impact our brain in a positive way? Because rather than try to treat a condition after it's already developed, if we can focus on preventing something from happening, then we've really made a difference in somebody's life. Or quite frankly, we take self-responsibility for preventing these things from happening. So I've listed here on the slide several things that have been proven to make a difference in preserving cognitive function. And on top of the list, and on top of many, many lists that you read for prevention of chronic diseases, is exercise. Time and time again, studies have shown that exercise, and it doesn't have to be real vigorous exercise, any type of exercise, does two important things. It increases circulation to the brain in those four highways that we talked about, right? It gets circulation to the brain and keeps the brain adequately supplied of nutrition and oxygen, which is what it needs the most. The second thing it does is it releases important chemicals in our brain, as well as our body in general, that keep our general sense of well-being, our emotional well-being at a higher level. Exercise is probably the best antidepressant known. None of the medications that we prescribe compare to exercise in terms of helping people deal with depression and other mental health conditions. We know that there are nutritional factors that are proven to be preventative, and specifically that's in the area of what you've heard of as a Mediterranean diet, which is a low-fat diet that is typically in many cases more plant-based. And so there's a lot of data and information supporting that nutritionally we can support our brain in very, very healthy ways. And so part of the comprehensive assessment is that nutritional assessment to say, well, you know, if you really stopped using these sorts of things in your diet, but added more fresh fruits and vegetables, it might really start to make a difference in your cognitive abilities and cognitive function, and certainly stabilize things. Hydration, surprisingly, is an important component of healthy brains. If we are not getting enough fluid intake in a day's period or in a couple of days period, we're not going to get enough circulation to our brain. So hydration, just like exercise, becomes critical as a preventative strategy. It's a no-brainer to say that avoiding toxins to the brain probably is helpful to the brain, and that's exactly right. We know that things like tobacco and alcohol can be directly toxic to the brain cells, and to the point that they may not function normally and they may not recover as well. Hypoxia just means low oxygen levels, and specifically when I think about that as it relates to brain health, I think about how we sleep and what happens with our oxygen levels when we sleep. And if we're not getting adequate sleep, or if our oxygen levels are dropping, particularly while we're sleeping, then that's a risk to the brain over time, and our brain will not function as well as it normally could or should. Many studies recently show that social engagement and interaction is critical to healthy brain functioning, and without it, which we've all been suffering through immensely through the whole COVID crisis, without that social interaction and increased isolation, we really run the risk of more cognitive impairment developing. We're seeing that as an outcome of dealing with a pandemic in this country and across the world. It's important to manage any associated risk factors that are impairing those main things that we talked about as far as energy, impairing circulation or impairing oxygen and glucose supply to the brain. If you don't manage your high blood pressure or manage your diabetes or keep your weight under reasonable control, keep the cholesterol under reasonable control, or deal with mental health issues like depression, we know that all of those things increase our risk of cognitive impairment and dementia. And finally, trauma prevention really becomes important, and I see this way too often. Even though we're encased in a hard skull, a fall, a serious fall, falling off a ladder, falling from a height of any sort, hitting your head, damaging the brain, can be very, very detrimental as we get older, and the recovery is much slower after a head injury, and there's no guarantee that the recovery will be full. So prevention of trauma or injuries to the brain becomes more important. And so that's why that functional assessment as part of that comprehensive assessment is helpful, because we can identify people who might be at higher risk for falls. And if they're at high risk for falls, we can help give them some strategies on how they might prevent that. So lots of things we can do to keep our brains healthy. So I'm again, very proud to share with you that YRMC and Dignity are coming together to develop this comprehensive cognitive assessment clinic. The Alzheimer's and Dementia Care Program has started, and if you're interested in more information about either of these programs, either as they develop or are in place now, please contact us with the information that we'll share with you. Not only will the Cognitive Assessment Clinic be up and running, but the ability to refer for more detailed evaluation. If there are some question in terms of diagnostically what may be going on, if we need more clarity, then a referral to a higher level neurological evaluation and assessment can be a part of the outcome as well. Additional testing and screening when necessary, or follow-up as necessary. In other words, we might have an idea that it looks like there's something going on with your brain function. We're not quite sure what it is. Let's get together in 4 to 6 months and revisit, maybe do some additional testing or repeat some of these tests and see if there's evidence that things are progressing. Because sometimes if we catch things in early stages, we're not sure if we're just seeing that mild cognitive impairment that really isn't going to impact a person's ability to function, or whether this could be a progressive condition that might start to impact functioning. And then I mentioned the Alzheimer's and Dementia Care Program. That's the program that we think is going to be sort of the handoff program after the assessments are done, to say, here is a support program that's really designed to improve the quality of life that you and your loved one with dementia are experiencing in the community. More information will be available on the Health Connect. That website is available for you there. And I guess I would leave in conclusion the understanding, kind of coming full circle, if you will, that we really need to live a full life with one brain. Back in the early 1900s, average length of life was probably around 50 to 55 years old for both men and women. Now, the average age for women is about 82, and the average age for men is probably 78 to 80, and those ages continue to gradually climb, and certainly we all know people who are living vibrantly in their 90s and approaching 100 and doing well, and some of those folks may not have the best brain function or may have significant brain deterioration as they age, and what we can do to really diminish that probability of brain impairment really becomes a matter of personal responsibility, of taking care of ourselves and our brain as best we can. What I find in the community when I talk with older individuals is their goal isn't necessarily to live to be 100 or live as long as they possibly can. Their goal is to have a high quality of life. Their goal is to live better, not longer. If they get the longevity, that's great, but they don't want longevity without quality. And so that personal responsibility for quality really becomes important. So don't ignore the check engine light, those little signs or symptoms that either might be happening for you or for somebody that you love and care for and know about. Don't ignore those as, oh, grandma's just getting a little bit older. And it may be that this is an age-related condition, but it could also be a sign that something more significant is developing. And the quicker we can understand that, diagnose that, and plan for what that means for that individual, we really believe that it will improve quality of life for both the individual and their loved ones as well. And caregivers, as mentioned, are the critical component to keeping people in the community, keeping the cost of care down, but caregiver support remains a critical component of what our programs will be focusing on. So this is information, contact information for you if you have specific questions about either of these two programs, the Comprehensive Assessment Clinic or the Alzheimer's and Dementia Care Program. Please feel free to contact this number. I'm very grateful for your time and attention today, and hope that this has been helpful to you. And we probably have a little bit of time perhaps for some questions that you might have, and we can start that process now. So I would say there is absolutely no point that is too late. We know that the later we start to address brain issues, the more difficult it is to get the brain to recover. But because of that duplicity that we talked about earlier and that plasticity, the ability for the brain to pick up other functions after there's been damage or injury, tells us that there's always potential. And that's where rehabilitation can be very helpful. And just like you have physical and occupational rehabilitation after a hip replacement or a knee replacement or a back injury, you can really have brain therapy that's done as well. And oftentimes that's done in the context of speech therapy. Speech therapists are oftentimes excellent providers in doing cognitive assessments as well as doing cognitive therapy to help stimulate our brain. We also know that challenging our brain throughout our lifetimes, even when we're older, challenging our brain to do new things, learn new things, use parts of the brain that we haven't used for a long time. All of those things can be beneficial to not only sustain brain function, but improve brain function as well. So it's never too late. Absolutely. Medicare especially has a particular code related to comprehensive geriatric or senior-related assessment. And so insurances will certainly pay for an assessment, and there probably, as far as I know, there will not be any additional costs to anybody unless you have co-pays or unless you have a deductible that you haven't met there, that insurance would cover this. So the answer is both. You can make for the YRMC Cognitive Assessment Clinic, you can self-refer, or a loved one can refer their loved one to come, or you can come via a medical provider's referral as well. We want to make it as open and available to people as possible, encouraging people to get these baseline comprehensive assessments. That is one of the toughest things we run into. And when we were talking about barriers to getting cognitive assessment, probably the biggest barrier that I see is people's unwillingness to have a cognitive assessment done for one of two reasons. They know there's a problem developing and they don't want to find out about it. Or what can also happen with our brain, which also protects itself in many respects, is the person doesn't realize that they have a problem developing. They don't believe they have a problem developing. And you can tell them all day long, well, it seems like you're slipping here and there, and we've noticed this and that, and they will say, no, I'm fine. So those are really, really challenging questions to say, how do we encourage folks to get those assessments? What I oftentimes do is suggest, let's start with a basic checkup with your doctor. Let's just be sure there's not something else going on. Let's get some routine blood tests and check things out. Let's talk with your doctor a little bit about that. And again, sometimes those office visits are really contracted. They're limited in terms of time. But if you can set up an appointment with your primary care provider just to talk about what we're noticing with perhaps some cognitive changes or other issues, that some of those warning signs that may be coming up, then that provider can then become an asset, also a supporter of saying, let's take a little bit further look here. Let's get a scan of your brain, or let's have you see a neurologist, or let's send you to the assessment clinic and get a little baseline here, because it might be helpful not only for today, but looking into the future as well. But those are oftentimes very tough. You almost have to rope somebody into getting in to get these checks. And the question as it was posed talked about when he doesn't want to come in to get it, because it's oftentimes men who are more resistant to getting things checked out, even if they may be aware that there's a problem developing. But keep encouraging. You can't push too hard. That oftentimes results in somebody getting even more resistant. But keep encouraging and start with that basic check-in with a regular medical doctor to be sure everything else is okay. Be sure you don't have diabetes or high blood pressure or sleep apnea, things that might be looking like cognitive impairment developing, but actually have a secondary or another reason why that's happening. So the medical assessment is really focused on being sure that there's not something else going on. And specifically, there are a number of different what are called neurodegenerative conditions. And that means neuro meaning brain, degenerative meaning that it's declining in some fashion. And what we want to do is rule out other causes that might look like Alzheimer's disease or might look like dementia, but in fact turns out to be something else. Could be, for instance, Parkinson's disease. Could be a developing brain tumor, could be some other type like we talked about, a nutritional deficiency. So that medical assessment that's done as part of the comprehensive assessment is really a very thorough neurological examination to be sure that we're not missing something else underlying that might be explaining a changing condition. It could even be related to a heart rhythm disturbance that somebody wasn't aware of that's causing small little tiny blood clots to go to the brain and cause little tiny strokes that someone might not be aware of. So it would really be a basic medical assessment looking for those sorts of reversible things or other causes of cognitive impairment, but a much more detailed neurological assessment. So we divide Alzheimer's into early onset, which is before the age of 65, and late onset, which is after the age of 65. Now that's an arbitrary line. Alzheimer's disease is a specific type of dementia that causes pathologic changes in the brain tissue that really basically, to simplify, just gum up the system, slow the brain functioning down, make memory and other cognitive domains impaired. And so there's not a specific age, even if you have a history. There are some genetic tests that could be done if you have a family history of early Alzheimer's disease. That's where I would recommend either early genetic testing or early cognitive assessment, which would be before the age of 65. But if anybody is noticing, or a family member is noticing and is concerned about those early warning signs that we talked about, any of those check engine light things that come on that tell us there might be a problem developing here, I would say there's no age limit or there's no age restriction to say you shouldn't get it before the age of 40 or something like that. It really should be based on what you're experiencing from a symptom perspective, and with that family history, only if the family history is of early onset Alzheimer's disease, which is a specific genetic variant of Alzheimer's disease that would be beneficial to do early testing and have that baseline, because that baseline can be really helpful to compare to in future years if you do start to notice some significant problems. To suggest that there is a diagnosis that associates specifically with when somebody is no longer safe to be living alone. But these are such important questions for families, because mom lives in Cleveland and is living by herself, and now we're seeing that she's having trouble paying her bills. And here we are in Arizona trying to figure out if something's going on with mom, and is it time to move mom into an assisted living or have somebody take over her financial affairs. These questions come up so importantly. And so there's no line in the sand that says when you reach this point, you can no longer safely live alone. The other big issue that comes up is driving. When do we take the car keys away from somebody when their cognitive impairment is reaching a level? Now, with mild cognitive impairment, the answer to the question really is they can continue to live alone with mild cognitive impairment, because by definition, mild cognitive impairment does not associate or does not affiliate with a functional decline. Once it crosses over and now they're having functional problem, that's no longer mild cognitive impairment. And then you have to look at the other domains of how they're doing, those other domains of brain function, how they're communicating, how are they as far as safety awareness in their home by themselves. And those are very difficult questions. But we try to intervene as quickly as we can when we see an issue suggesting that somebody is no longer safe at home, because if we wait till after their fall and hip fracture, or after they've left the stove on for 20 minutes and caused a fire in the apartment complex, we've waited too long. So knowing about the situation early, having an idea that there may be some developing changes, and then really looking at how the person is functioning on a day-to-day basis with their own ability to take care of themselves will help define when it's time to get somebody into the home to help them, or to think seriously about moving them to some kind of a controlled setting or supportive setting. We're fortunate in this community that not only do we have community resources in town, but we're also developing more community resources all the time. As we grow, we get more resources that are particularly targeting patients and families that are dealing with cognitive impairment. I would say Alzheimer's Association always shows up number one on my list of referrals of where I suggest people get not only information and education, but also support. We recommend peer counseling from the West Yavapai Guidance Clinic, because that also can be very helpful. And then we really try to refer people for respite services, and we're talking primarily caregivers. The caregiving job, as many of you know, is a 24/7 experience. And only if that caregiver or their family provides for some sort of relief or respite is that caregiver ever going to get a break. And if the caregiver breaks down, then we know that the situation can fall apart very quickly. And that's another reason why this Alzheimer's and Dementia Care Program, or ADC program, is being developed by YRMC to specifically target both individuals living with cognitive impairment and their caregivers, and support them in their home as much as possible. So there are other resources like Meals on Wheels can be very helpful to take the pressure off of a caregiver to having to make meals all the time. And then other counseling services, both for the individual with cognitive impairment, but also for the caregiver as well. So many resources already available, many resources being developed. The issue is, are there permanent changes that occur from medications that might be impacting the brain? I would say this: if a medication has a side effect that is causing cognitive impairment, in other words, it's not designed to impact the brain, but it has that side effect, stopping that medication, in most cases, the side effect will go away and improve. There is also then the potential for interaction of medications, and sometimes those interaction of medications can cause more long-term side effects that might not improve when you take one of the medications away. But that thorough pharmacy or medication assessment is really important, and it includes the importance of over-the-counter medications. Because a lot of times when you go into your doctor's office or provider's office and leave a list of what medicines you're on, you don't think about writing down, well, I also take Tylenol PM at night to help me sleep, or one of the other PMs, which is an over-the-counter sleep aid. But when you look at the ingredients of those medications, one of them is often that you'll see is Benadryl. And Benadryl is an antihistamine. and as an antihistamine shows up as on a list of medications that should be avoided in people over the age of 65 because of the risk of cognitive impairment and impacts on falling, confusion, disorientation, and just cognitive ability. So there is a very good chance that stopping an offending medication will be helpful. In some cases, we're not certain whether that will allow somebody to get back to their baseline or better. And the other one I worry about a lot is anesthesia, because anesthesia seems to impact older brains in different ways than it does younger brains, especially if it's prolonged anesthesia. So more and more in the work that I do, I am really encouraging people to not consider surgeries unless it's clearly indicated and the risk of anesthesia has been thoroughly explained to somebody. And quite honestly, I think a comprehensive cognitive assessment prior to a major surgery can be very helpful in identifying early stage conditions that may not, necessarily be out on the surface or that the surgeon wouldn't be aware of in advance. So that may be another setting where a comprehensive assessment can be very helpful, is prior to an anticipated major surgery of some sort. So driving is always one of those challenging areas to deal with, because it is one of those things that really identifies us as independent human beings. Is when we can walk out of our house, hop in a car, turn on the keys, and drive away. That is a level of independence that we underappreciate, number one, but when that's taken away from us, it can be devastating to people. And it also starts to really then impact a person's isolation and ability to get out and be socially engaged in the community, which is also good for the brain. So when somebody stops driving or is told to stop driving, I wish there was a real clear marker that said this is when you can drive and this is when you can't drive. But that would imply that on one day you wake up and you can drive, and then the next day for some reason you wake up and now you can't drive. So it's a gray zone, but it's a gray zone that really has to be looked at from the comprehensive perspective of the person's ability to function in general. What are their basic motor skills? That's where a physical functional assessment by a physical therapist or occupational therapist can be very helpful in identifying a concern where driving might be an indication. And then the other issue that comes up a lot with that is, when do I start using an assistive device to ambulate or to walk around with? When should I start using a cane, or when would a walker be indicated to help me prevent a fall and a potential serious injury as well? So I would say those are probably well, you've actually identified all three of the major ones. When should I stop living alone? When should I stop driving? And when should I consider using an assistive device? And those three things really vary on an individual basis. And you can't look at a brain scan or an MRI scan of the brain and say, oh, you got to stop driving because of this, this, and this. It's really a thorough assessment that helps us identify when that need to make those changes has to be considered. Again, I would like to thank you for taking the time to listen to this presentation. It may have generated other questions for you. And if you have questions or concerns, or really not sure what's happening in your own life or the life of a loved one, and you need information, talk with your primary care provider as a starting point. I think that's important. If those questions aren't readily answered in that setting, you can always give us a call at our office, and the number and information is provided for you. Our office number is 928-775-5567, and that's the Palliative Care and Geriatrics Department at Yavapai Regional Medical Center. Again, thanks for taking your time today to listen to this presentation.